So I just want to give everybody a warm welcome to our Safer to Be Me symposium. Thank you everybody for being here. We welcome you to Report Out's global symposium to discuss LGBTQI+ human rights and development needs. My name is Ilya and I am a Sustainable Development Goals Officer at Report Out. Welcome to our online satellite event. The recording will be, you can find that on YouTube in the next few weeks. Our hashtag Safer to Be Me symposium is a partnership between Report Out and the University of Sunderland. And it brings together global activists, practitioners and academics to discuss the most pressing issues facing global LGBTQI+ human rights and LGBTQI+ progress towards fulfilling the United Nations Sustainable Development Goals. We have a range of online Zoom events prepared for you. We hope that this will get you ready for our symposium launch and for the main event taking place next week on the 22nd of June in Sunderland. And as part of our planning for Safer to Be Me, we wanted to offer some satellite events as online talks so that everyone can get involved in their own way and get excited about the symposium. There will also be opportunities for you to watch the talks on the main day of the symposium on Zoom as well, so that you're not missing out. The link for tickets on the 22nd of June can be found on our website and will be dropped in the chat box throughout this talk. We also have a range of previous events on our YouTube channel for you to watch, with discussion panelists from nation states such as Mongolia, Ghana and the Cayman Islands. Or we have talks on wider regional areas such as South Asia and historical talks such as the Men in Pink Triangle under Nazi Germany talk. So please do check out the channel. Our donation link will also be dropped in the chat box at different intervals. We're an entirely volunteer-led charity, so small charities like us could always do with your support, and your donation will go directly to all of the work that we do. So thank you. So to get started with our talk, joining us this evening, we have Obioma Chukwuike from Nigeria. They are an intersex and human rights activist, passionate about the visibility and promotion of intersex rights. They have 6 years of experience in advocating for different issues and challenges affecting intersex children and adults, and they also belong to various national, regional and international committees dedicated towards achieving intersex human rights promotion. Obioma is also a researcher and an environmental consultant who specialises in environmental conservation and sustainability. I will now hand over the presentation to Obioma, who this evening will be talking about the situation of intersex people in Africa in the context of the Covid-19 pandemic. We'll have time at the end for a Q&A, so please put any questions for Obioma in the chat. Thank you very much. I'll share the presentation, and Obioma, you can begin with your talk.
Thank you, Ilya.
No problem.
Hi, everyone, and welcome to today's conversation. I've already been introduced, so I'll just dive into the discussion of today. So I'm here to present to you the situation of intersex people in Africa during COVID-19. We know that COVID-19 hit us at the late part of 2020, and up to date, COVID-19 is still a global health challenge that has affected both the socioeconomic, political, and environmental states of the globe. So during the peak and heat of COVID-19, the global intersex movement thought it wise to find out the situation of its community around the globe And in Africa, we're able to do a report that I'm going to be sharing with you people this moment to give you people an insight on what the report was able to show us. Please, the next slide, please. So before I go into the vulnerability factor that was used as an indicator to do this research, I'm going to share the highlight of how the findings was conducted. So this research was done in Africa, obviously, and there was a survey filled out by 29 African intersex people, including 2 family members of intersex people responding on their behalf. And it also came from 9 different African countries, including West Africa, Southern Africa, and East Africa. I know some people will say, oh, what happened to North Africa and Central Africa? It has been a challenge because of some of the social factors that affect human rights in Africa to get intersex organizing in Northern and Central part of Africa. So for looking at the charts, you will see that there are factors of increased vulnerability. And on top of the chart is gender identity and gender expression, which has about 62%, economic status, sexual orientation, citizenship, and resident status. We are the top 4 factors that increase the vulnerability of intersex people during COVID-19. Please, the next slide, please. Okay, so this part, we went deep to, check the areas that were impacted on the lives of intersex people during COVID-19. We tried to check out how there are areas of finance, the mental health, and intersex activism, including employment, housing, and so on. And you can see from the charts, we discovered that the finances of intersex people were greatly affected, just like every other population. But the reason why it stood out for us is because in previous assessments that we have done in national assessments of different intersex-led organizations in Africa, one thing that always stands out is how intersex people are always discriminated in work environments. Most times they find it difficult to get jobs, access employment, because their gender is being questioned, or their sex characteristics, physical sex characteristics is being questioned. Just like the vulnerability factor that I shared earlier, we'll find out that the gender expression and gender identity, which often is a challenge for intersex persons, is also one of the reasons why they are at great risk of discrimination. And COVID-19, during lockdown, they had no access to gain employment or to find menial jobs that will keep them moving. So that is why you see that the finance is on top of the charts. And of course, their mental health will be affected, because when you don't have finance to, take cater for yourself or take care of your basic needs, you will be in a good disarray of your mental health. And intersex activism was also affected because intersex people always find space within their locality or their nationality to interact with one another and find out how they can provide peer support to one another. And during COVID-19, most of the countries in the peak of COVID-19, most of the countries in Africa were on lockdown, and most intersex people could not interact with one another. Some of them did not have access to internet, so they couldn't actually have the opportunity to speak to their peers and find out how each other is doing. And even the leaders in the organization, activists, could not organize webinars online because most intersex people did not attend those webinars because they do not have access to internet, and sometimes they don't have access to electricity. And this isolation period affected their mental health. One or two of intersex persons during the report of this research shared that they had COVID-19 and they were in lockdown with other members of society, and they felt a great sense of insecurity because they felt like if their sex characteristics, variation in their sex characteristics is discovered, they might be, in great risk of discrimination and stigmatization. Please, the next slide. So we went further to look at how interconnected this, in our analysis, went further to look at how interconnected areas of intersex life that was affected by COVID-19. And you can see that finance and healthcare was a major challenge because there was a lockdown, and in that period, there wasn't much access to healthcare provisions. And they're also shared in the report. If you read through the full report, you find out that most intersex people expressed how they were unable to meet with doctors that were already familiar with their situation, and also were friendly, because most hospitals were not friendly with their situation. And when they want to assess healthcare needs, they only go to a particular doctor or a healthcare facility. And most healthcare facilities were on lockdown during that period. And because they have limited access of finance too, they couldn't, find alternative means of healthcare during COVID-19. Then talking about healthcare and mental health, for intersex community, the healthcare of an intersex person is very paramount because it's the center of our existence. Our healthcare is something that we are very particular about, and most respondents express how their mental health was greatly affected, because if you're talking about holistic healthcare, we know that mental health is part of it, because most of them couldn't access the medications that they needed. The medications became very expensive. Even in some over-counter places, they couldn't even access those medications, and they couldn't have access to their medications. They couldn't have access to friendly doctors, and they were also unable to speak to mental health support personnel, because there was a lot of isolation in that period, and there was reduced number of services by healthcare providers, because everybody was focused on treating the cases that came out from COVID-19. And this affected a lot of intersex people's mental health and well-being. Then safety and human rights was another interconnected area. Most respondents decried how they were staying with family members, friends, or partners who constantly abused them because of their variation in their sex characteristics. This area was very troubling and sad, because a lot of intersex respondents expressed how, because of the lockdown, at that point, they had to some traveled back to their family houses where they have family members, and some stayed with friends, maybe where they were already staying with friends, and some were already staying with their partners. And some expressed that when they were back to their family members always addressed them with wrong pronouns, discriminated against them, and looked at them differently, because some of them already, when they were out of the house, they were expressing themselves very boldly, but back in the house, because there's a lot of disconnect in understanding of their bodily autonomy and expression, the family members were also discriminating against them. Some of them were very confused with their gender identity, because most of them had maybe changed their gender identity from what their family members used to know. So that became a very huge challenge for them, and they couldn't move because lockdown was there and restriction was very, very restricted. So they had to, keep up with an unsafe environment, which affected their, of course, or which also affect their mental health and also affect their sense of safety. Because we know that when you are not able to express yourself or stay in an environment where people love you or show you care or discriminate against you because they perceive you differently or because you look different or because they feel like you're a curse or you're a taboo, you find out that you'll have a lot of sense of violation in you. Please, the next slide. So in conclusion, this report actually further decried that intersex people have always experienced a lot of marginalization, discrimination, because this report actually showed a lot of sensitive situations that intersex people face in their life. Not being able to access the type of employment they want to access, not being able to have the family care and support that they need, not being able to have access to free and friendly healthcare services whenever they want it, and also not being able to take care of their livelihood, which is like the first point of contact as for every human being able to get what you want as a basic amenities. So public access to healthcare is difficult, as many intersex cannot access friendly healthcare services and facilities and services. Some do not have the finance to seek good healthcare practitioners, medications they require to manage their health situations. The pandemic had a limitation in person interaction of activists and intersex people and intersex movement. This during the pandemic, I can tell you that the African intersex movement suffered a lot of setback, because then the African intersex movement was still trying to be progressive with organizing, but the COVID-19 hit and a lot of things, stopped. We couldn't organize, we couldn't meet, we couldn't interact, and everybody was focusing on their health and their safety. Personal safety was not guaranteed, as many intersex people became victims of abuse, discrimination, and violent attacks. So in all, there is need for continuous assessments of various situations of intersex people in Africa and also globally. And there is also need for support, peer support, psychosocial support, and need to also find out how we can increase visibility and understanding of what intersex really means. Because in Africa, one of the major challenges that we have here in Africa is that most people do not understand what intersex really means, what it means for someone to have variation in their sex characteristics. In most parts of Africa, people find it awkward, don't believe it at all that is existing, and sometimes intersex babies are killed because they are seen as taboo or curses, and sometimes they are even killed as infants. Infanticide happen. So some of these issues are the reasons why there is a need for increased support for intersex visibility and human rights promotion. Thank you very much.
Thank you so much. That was really, really interesting. I'm just going to stop sharing and have a look at the chat for any questions that we've got now in the Q&A segment. So we have one question from an attendee. What can be done by practitioners in, I assume, a practical sense in terms of policy, following the conclusions that you found from this report?
Okay, thank you very much for that question. Well, what can be done is from my own perspective, of someone that has been in the field, two things are the major things that the immediate response. We need to create more awareness. People, healthcare practitioners, I know that they're experts, but I don't think they understand the implication of not providing friendly access for intersex persons. Because if an intersex person, like I have that experience too, and most intersex people that I've met have that experience too. When we go into the hospital and we are trying to seek for services, and at some point, if the discussion happens that the medical practitioner finds out that you are intersex, you'll find out that the discussion about what brought you to the hospital changes. It changes the whole topic. And sometimes it has to do with your reproductive rights or reproductive needs. You'll find out that they don't even have the capacity to provide you with the right information that you need as an intersex person. So there's lack of awareness, and also there's a gap in knowledge for the healthcare practitioners. I've had discussions, dialogues with healthcare practitioners, and most times what comes out from it is that there is no concrete information for them on how they can go about these, situation or issues that might come up for intersex people when they visit their facilities. So it's about awareness, continuous awareness and visibility about the issues and how they can actually provide friendly services. Then secondly is how policies can be created. Now, this is the part of where the government comes in. They have to create a system where intersex people are included in public health services. There's something they call primary healthcare system, for instance, in Nigeria. If, for instance, the primary healthcare system has a space for intersex people or intersex babies, you find out that doctors will take it serious. But when there is no space for variation in sex characteristics, when there is no space for intersex people incorporated in different systematic structures of the healthcare systems, you find out that the healthcare practitioners don't see it as a need to provide or even improve in that area. So these are like the two huge things that can be done: creating awareness and visibility, and the government creating policies, inclusive policies that can protect intersex people.
Thank you. Yeah, that's a fantastic answer. And, covers healthcare and policy, both really, really important areas. We also have another question in the chat, which I suppose links into the first part of your answer about awareness and increasing visibility. How can we, I assume we as in just the public, advocate for intersex issues to support intersex visibility? What can we do?
All right. How can we advocate? Both that's external audience now. Yeah. There are things that can be done. The first part of it is equipping yourself with knowledge around what intersex really means, because that's the first point. If you understand it, it's easier for you to advocate, because you can't advocate what you don't understand. So equipping yourself, educating yourself, interacting with the community as much as you can to understand the top priorities, the needs of the community. Then the second part to it is incorporating it in your own model of whatever you are doing. It mustn't be an activist, an intersex activist or a human rights activist to advocate for intersex rights. You can be advocating for intersex rights in your own space. Maybe you are an engineer, and in your own space, you ensure that there's no discrimination happening. That maybe an intersex person wants to get employment, but because their sex characteristics or stress traits is not well understood, people are discriminating against it. Creating a safe environment for intersex people to exist, creating a safe environment for intersex people to feel like, oh, they are part of what is happening around here. That's another part of it, as being a good ally. Another part to it is supporting what the intersex movement is doing around the world. And there's a lot of intersex organizing, both in Africa, Europe, United States, all parts of the globe, supporting them by maybe ensuring that they get funding, or ensuring that they get the resources that might need, or ensuring that if you're a policymaker, maybe in the international arena, that you push for intersex policies or resolutions. Or another thing that can be done is, helping the local. Now I'm talking about the human rights organizations. The human rights organization incorporating into their own agenda intersex topics, because you find out that even within the LGBTQI community, I understand that we are one family, but when you talk about the inclusion, it looks like the intersex community is still that there's this margin. So how can we ensure that we are holding spaces for one another? Holding spaces for one another is another key thing that can be done. So there are a couple of things that one can do depending on what you are doing and your area of expertise. But there is always something that can be done to include. Inclusion is very, very important in whatever that is happening around it. Thank you.
Thank you. That was a fantastic answer as well. And that looks like that's all the questions from the chat. I have a question for you as to how we can follow your work, where is best to keep an eye out for you and your work, or even where to follow intersex human rights activity more widely. Do you have any things that could be useful for our audience following from this conversation?
Sure. So I work with Intersex Nigeria. I'm the founder of Intersex Nigeria and the executive director. So we have a website, www.intersexnigeria.org. We are also on Instagram, Facebook, and Twitter. You can type Intersex Nigeria. There's different handle. For Instagram is intersex_Nigeria_. For Twitter is IntersexN. Then for Facebook is Intersex Nigeria. So if you're able to take a glimpse into any of these or 4 of these social handles that I've mentioned, you find out what they're doing on ground as an organization, and also you find out what you can support us with if you also want to support us with something. So it's the channels that you can use to access Intersex Nigeria and the work that we are doing there.
Perfect. Thank you very much. That has been a really, really fascinating talk. That is everything from us. For participants, the symposium will be carrying on with events all week, so make sure to get your tickets for that. And one last thank you to Obioma. Thank you very much. Bye-bye.
Thank you for having me. Bye.
Thank you. Goodbye.